certification program is a significant accomplishment that requires commitment, perseverance, and focus. You're entering a dynamic profession with many career options, opportunities for growth, and potential for leadership. As a nurse, you can dramatically improve people's health, even save lives. The practice of nursing is one of the most highly regarded professions in the country. In Gallup polls, the public consistently ranks it as the most ethical and honest profession in America.
I chose a career in nursing because I wanted to make a real difference in patients' lives. My education prepared me to provide high-quality clinical care to patients, and now that I'm practicing, I'm recognizing how important the laws are to providing excellent care and maintaining a safe environment for my patients.
Like other healthcare professions, nursing is regulated by law to ensure safe practice. In the next few moments, we'll talk more about the ways the profession is regulated through nurse licensure, state boards of nursing, and state laws called Nurse Practice Acts. With more than 4.5 million individuals holding a nursing license, nurses are the largest group of licensed healthcare professionals in the United States. You need to pass the National Council Licensure Examination, or NCLEX, to receive a license. But becoming a registered nurse involves more than just meeting this standard. Think of becoming licensed as a privilege that's been granted by the law. In fact, it's a commitment between you and the public.
Nurses need specialized knowledge, skills, and abilities to make decisions about patient care. Patients come to us in their most vulnerable state. The public sees nursing care as something so valuable and significant, something that embodies such trust and expert knowledge, that laws have been established to regulate our practice. Licensure is one aspect of that regulation.
Once you're licensed, it's your responsibility to keep your nursing license current. The renewal process varies across states. For instance, a majority of states require that nurses complete continuing education credits, including specific coursework in some cases, before they can renew their licenses. The consequences for not renewing your license can vary from a fine to other types of discipline. You may even be required to retake the NCLEX.
I recently accepted a telehealth nursing position, so now I care for patients in multiple states. Since practice is where the patient is, I need to be licensed in every state where my patients are located.
There's one important exception to needing a separate license to practice in each state where patients are located. Many states belong to the Nurse Licensure Compact. If your state is a member, you may be eligible for a multi-state license, which allows you to practice in other compact states without obtaining a license in those particular states. Your state's Nurse Practice Act and regulations will confirm whether your state is part of the Nurse Licensure Compact. The legal authority to practice in the nursing profession comes from each state or territorial government. More than 100 years ago, boards of nursing were established to protect the public's health and welfare. Boards of nursing serve many functions, which typically include granting and renewing licenses, developing practice standards, writing administrative rules and policies, disciplining unsafe nurses, and accrediting or approving academic nursing programs.
I encourage my team to learn about how our Board of Nursing works and to familiarize themselves with the Nurse Practice Act. I also suggest that they read our board's newsletter and visit its website to stay informed about any changes in nursing regulation.
Each state or territory's Nurse Practice Act is a law enacted by the state's legislature and enforced by the Board of Nursing. The specific content of Nurse Practice Acts vary from one jurisdiction to another, but there are three basic components included in every Nurse Practice Act: standards and scope of nursing practice, requirements for licensure, and grounds for disciplinary action. A Nurse Practice Act is the law governing practice, and administrative rules or regulations provide more specific information.
Keeping the public safe is a shared responsibility, and everyone on the team has to play an active part.
As a nurse manager, I've seen a few problems over the years with nurses who violate the Nurse Practice Act. Being aware of your Nurse Practice Act helps prevent violations.
Even new nurses who are just entering the profession need to be aware of their role in preventing, detecting, and reporting potential violations. These may include significant practice-related errors, drug-related issues or substance use disorder, professional boundary violations, sexual misconduct, patient abuse, fraud, and criminal background. Depending on the severity of the violation, the Board of Nursing sanctions may include a reprimand, probation, remediation, fines, license suspension, or even license revocation.